going on in the body. And we have to be very specific. Now remember that we say that this is the apex. Okay, the apex is on the left, the down part, and then the upper part is on the right atria side. So if we can place a positive electrode on the left lower limb, okay, so what we would have is, okay, a positive electrode, and then we could have a negative electrode placed right there. Now what we would go back to see is the deflections that we talked about. So we see that if a positive, okay, is approaching a positive, we would have a positive deflection, and if a negative is approaching a negative, we would have a positive deflection. And then we would also have a positive that is approaching a negative electrode, we would have a negative deflection. Then finally, if the negative was in this case repolarization was going towards a positive electrode, would have a negative deflection. And go back to the magnitude as well as the size. Magnitude is size, so magnitude as well as the speed. I beg your pardon. All right, so this is what we're going to look at. Now remember that we had specific depolarizing waves and repolarizing waves, and how fast they were, how slow they were, described in our last class. So that is what we're going to use to learn. Now, just as a reminder, we had in the atria, we had leftward and downward. It was small and slow. We didn't quite see anything in the AV junction, but we did see a septal one that was also small, but this one was rightward and upward. Then we had a big downward and leftward ventricular, should I say, Purkinje fiber wave. And then we also had repolarization, okay, going upward and rightward. Then we had the basal that were also upward and rightward, but the difference was that these were positive, so all the green ones are positive, and then we just had one of the negatives. We didn't quite see the repolarization going on in the atria, because that was the same time that we had repolarization going on in the depolarization rather going on in the ventricle. So now we're just going to appreciate what happens in this case. If we had this set of electrodes connected as positive, okay, positive down here, negative up here, and then we connected this to the galvanometer, and it was on a piece of paper moving, as we said in the earlier classes, what would we see? So first of all, we're going to see, we're going to appreciate what is happening SA node, from the SA node. So we noted that the right atria and the left atria depolarize immediately after the SA node fires, and the vector is small, and it's downward and leftward. So we observe that if it is downward, let's go back to our isoelectric line. So first of all, before firing, you wouldn't notice anything, but if it is downward, it is positive wave approaching a positive electrode, so you find that it will go up. Yes, all right, so that is the direction. What about the magnitude? It will be a small vector because we're talking about atrial strips or an atrial area, so it will be a small vector. All right, what about speed? So we say that this area is slow, so you're going to see that it's going to be wide. All right, so I think it's going to be above, small, and wide. Okay, so that's the first wave. This wave is known as the P wave. All right, so that is the P wave. Now we're just going to see what next. So after the P wave, we're then going to go to so I'll draw the P wave right at the bottom here. All right, sorry, I'm going to leave it there. Okay, remember, after complete depolarization, it will deflect to 0, so you find that it goes to the isoelectric line. So we find that within the AV, we don't know what is happening. So because we don't know what is happening, we do not record anything. So we just have AV depolarization being quiet, not picking anything. So we just have this, what is known as a segment. We just have a straight segment. All right, the next part that we're going to talk about is now the Purkinje system. So in the Purkinje system, the first thing that we have, remember that these are all going to be fast, so they're not going to be that wide, they're going to be narrow. So the first thing that you have is septal. Okay, so septal depolarization is going to be small, and it's going to be upward and rightward. So these are positive ions that are going towards a negative electrode. All right, so in terms of direction, you're going to see that it's going to go downward because it's positive going towards negative, so you're going to have a negative deflection. So negative deflection will go down. What about the magnitude? Because it's a small area, you'll find that this is actually small. And of course, we said about the speed, it's going to be fast, so we're going to find it as narrow. Sorry for that. So it's going to be down, small, and narrow. So just like that. Okay, let me do that again. Just gonna have a V. Okay, so we could have this V. So this V is of course given a name, and this is known as the Q wave. Right, so I'm going to add the Q wave to our, okay, that's the Q wave, and of course it comes back to the isoelectric line. Okay, sorry, just wanted to be a little bit, all right. So that is now septal. So let's go to the next depolarizing wave. The next depolarizing wave is large. It's in the Purkinje fibers. It's large and leftward. Okay, very large. So you're going to have direction, because it's positive going to positive, you're going to have an upward. Okay, it's going to be above the isoelectric line, and because it is large in terms of magnitude, you're going to have a very high amplitude. Okay, high amplitude in terms of the word, it's going to be very long. And then of course speed, these are fast, so you're going to have it as narrow. Okay, so you're going to have it up, narrow, and high, so something like that. So this is known as the R. Okay, the R wave. So let's try to put it on our ECG down here. So there we go. So this is the R wave, and let's just go back to this. This was the Q wave. Okay, so that is now the Purkinje fiber. The next one that I want to talk about is the basal fibers, basal fiber depolarization. So these were going, beg your pardon, they were all going rightward and upward. Okay, so rightward and upward, what are we going to see here? So first of all, in terms of direction, there's positive ions going towards a negative electrode. So in terms of direction, we're going to see it going down. In terms of magnitude, these are very small areas, so we're going to have it very short. Okay, short amplitude. Then when it comes to speed, we're still dealing with fast fibers, so it's going to be narrow. So it's going to be very similar to the Q, though most of the time you'll find it a little bit deep, but this is how you're going to view it. So this one is known as the S wave. So if we put it down there, we're going to see S wave like that. Okay, so that is the S wave. Okay, we're almost there. So the next one that we want to talk about before we go on is the fact that we have a repolarization wave. Now, in the repolarization wave, remember that we have atrial repolarization that is first taking place during the depolarization of the ventricle. The depolarization of the ventricle is the septum, the ventricular plus the basal. So it's the QRS. That all stands for what's going on in the ventricles. Okay, so that's A. B, we want to appreciate the fact that the ventricular repolarization, let's see if we can have this, is a negative. Okay, negative. So this is negative approaching negative. So in terms of direction, negative approaching negative electrode, you're going to have an upward, above. Okay, and then because it is I beg your pardon, so it's upwards. So in terms of magnitude, the vector is going to be large. Okay, vector is going to be large, so you'll find that it will have a high amplitude. Okay, now what about speed? Remember from the last time we said there's slow conduction here, so you find that it will be wide. So it will be a little bit high, positive, and wide, and this is known as the T. All right, the T wave. Now, before we put the T wave, I just want you to realize that when there is complete depolarization of the ventricles, there's actually no activity that is read off by the ECG for a while, and then the T wave comes in. So before I draw the T wave, I'm going to draw a segment and then the T wave. All right, there we go. All right, so and that's it. We have our ECG. So we have the P wave, that stands for the atrial depolarization. Then we have the PQ segment, that stands for the quietness in the AV. Then we have the QRS, that stands for the activities in the ventricle. And then we have the ST segment, that stands for complete depolarization, but before the T wave starts. And then we have, of course, the T wave, which is repolarization of the ventricular system. Okay, having done that, I'm going to speak a few more things about the ECG itself, the graph itself, and what it means. So see you in the next video.